Over the next 72 hours, 6 people in the ICU with COVID in Saskatchewan will be flown by air ambulance to 6 different hospitals in Ontario. Saskatchewan has 135 ICU beds, but that's only been made possible by shutting down surgeries and redeploying staff. Of those beds, most are full. The ICU count for patients is nearing 120. More than 80 of them are COVID-19 patients. Mo says there's evidence cases are dropping, but hospitalizations and ICU totals will remain high in the near future.
Hospitalizations and ICU admissions will lag behind those falling case trajectories. Usually trend by somewhere between 2 to 4 weeks, which is why we have made the decision today to begin sending some of our patients out of the province. It's to ensure that those patients continue to receive the very best possible care that they can, and to relieve some of the pressures that we currently have on our healthcare system in the short term today in Saskatchewan.
The government will be covering accommodation and travel costs for at least 2 family or support people for any of the patients who have to travel to Ontario. Mo also confirmed the government has formally requested help from the federal government for ICU specialists, specifically critical care nurses, respiratory therapists, and specialists who work heart-lung machines. Mo was asked if the situation could have been avoided if the government had acted sooner.
And people often say, is there things you would have changed in your response to this pandemic? Potentially we could have moved possibly a week sooner with the masking mandate, or maybe even sooner with the proof of vaccination policy that we had brought in place.
Opposition leader Ryan Miley says the government's to blame for the current situation, with the province continuing to lead the country in case and death rates and having among the lowest vaccination rates across Canada. Miley says the government's handling has been a disaster.
This Premier owes the people of Saskatchewan an apology. He owes the families and those patients who are on the planes on their way to Ontario, he owes them an apology. He owes this entire province an apology for the way he ignored the experts, ignored the modeling, and deliberately decided to put people's lives at risk. His choices have cost people their lives, and half accepting that he might have maybe done things a little bit different is nowhere near the responsibility he needs to take.
The federal government has confirmed to CBC that it's received Saskatchewan's request. It says it's working to fill that request and find the resources needed as soon as possible. Adam Hunter, CBC News, Regina.